Still on coronavirus, earlier today we spoke to Dr. Vedaste Ndahindwa, Public Health Officer at World Health Organization Country Office. He told us how close Rwanda is to defeating this pandemic. How far with the response? How would you describe the response in Rwanda, the response to coronavirus?
For me, I can say that the response, as we can see, is well implemented so far because it's being following the guidance of the World Health Organization. You remember, since the beginning of the outbreak in Wuhan, in China, few things were known about the virus. Mainly about the contamination, the spread, was that human-to-human contamination, things like that. All of these were unknown really, but any information that was gained during the different processes were shared to across countries and across different interventions groups. So since that, we have seen that the first case was declared in Rwanda on 14th March. But the way it was taken and the measures that were taking place showed really that Rwanda was prepared since the beginning, because it was not the day to be prepared. So the preparedness started a bit earlier. And you remember that preparedness even started with Ebola preparedness. And some of the measures are similar to fighting these viruses, including hygiene, hand washing, and this distancing, really, and the community engagement also that was part of that. So all of these are part of the structure that helped really Rwanda to detect quickly the first case and to maintain the response strategies that are being established. So for the moment, there is a team, a joint team with many people involved, including partners, including different levels like health professionals, security organs, and they are doing the job so great. Because as you can see, to fight this, first, we need to be able to detect quickly. Once detected, we need to isolate people who are suspected or confirmed cases. Then we make contact tracing of those who have met or who have contaminated. So all this package is in one package. Then those who are isolated, if positive, if confirmed cases, they are treated. So there's an infrastructure that were put in place to monitor them and to ensure that they are being taken care of and their health is monitored. So all of these are really great implemented. So the main challenge to all of this is when many things are still unknown, even though we gained a lot of knowledge around the coronavirus, but still we have to learn. So it is a learning process, but I can say that the response is doing great for the moment.
I understand the World Health Organization is working hand in hand with the government of Rwanda to, to treat, to isolate, to trace. When should we expect a peak? When should we expect a flat curve? When should we expect normal life, life getting back to normal?
So all of this depends on other assumptions. So we cannot say when do we expect A or B or C. For example, the peak depends on the spread. So for example, in the spread, we have 4 categories. Or normally we have 4 categories. One is no case, no outbreak. Another one is what they call sporadic cases. Some few cases that you can locate. Another one is what they call cluster of contamination. So cluster meaning we can have some cases in Kigali, maybe some cases in, in Western somewhere. That we call clusters. But the worst scenario is when there's something we call community transmission. In that case, we don't know who contaminated who. It's really a mess. And that situation is what we are trying to avoid, because it is what is the worst scenario. That is happening in Europe. That is happening in America. You can't say who contaminated you. They don't know. You know, just they're seeing cases increasing, and you don't know who is. And that in that situation, it demands a lot to contain the outbreak. So for the moment, we are trying to see that if things goes well like this, we can end the outbreak very quickly. But it needs involvement of everyone, including the population. Communities need to be at least educated, engaged, and empowered, at least to support the actions that have been proposed by the government and by the team that is following this. Some do not have an idea of what is happening, but a lot is being done to prevent that spread. So if we are not following the guidance that is being provided, the outbreak can be longer. But if we abide to the recommendation, we follow guidance, we can resolve this quickly. Maybe less than 2 weeks or 2 months, I don't know. But we need to follow that because whatever will happen, everyone should have participated in that. You know, we follow the guidance, it is resolved quickly. We are not following, then we make things worse, then it can be even longer than that. So we cannot predict, but what we need, our wish for everyone, is really to end the outbreak as quick as possible without determining the time. I may not know the time, but the effort we made, the higher the effort, the shorter will be the time for the remaining time for the outbreak.
Dr. Vedaste Ndahindwa, thank you so much for your time.
Thank you. I appreciate it.
We appreciate it.
Thank you very much.